And it's now a pleasure for me to introduce Terje Peetso from the European Commission, and she will tackle, I think, a very, very important subject that is already in all of our mind, namely the e-health issue. I must confess I have one of these wearables which is connected to my smartphone and which already is some example of this, but of course there are many, many other aspects to e-health, and the practicality will be very important because it's one matter to travel from Lithuania to Portugal to seek medical care, but to quickly have a phone call or a video conference is probably much faster. So what are the rules there? And we are very grateful to you that you will address it, I guess, some of these, because within 10 minutes it will not be possible to cover all of it.
Thank you very much for your introduction, and thank you very much for inviting us. I think that it is always a great pleasure for us to listen to the experts on the field and to understand what the needs are and how together we could address this issue at the best. Yes, I always find that it is sometimes confusing when people see where I'm coming from, that I come from DG Connect. Well, the short name actually says everything what it is. It is about connecting. But we have also there a unit which is dealing with digital health. And I think that it is a good example of this idea of health in all policies, or let's say health in another policy, and how we can bring also the knowledge which is in that area about the digital technologies into the field of health. And because of my medical background, I feel very comfortable in between these two fields of medical and digital technology. I am not really trying to take a lot of your time out of your coffee break, actually. I feel that you have already been quite a lot here. I have one slide only, and I would like to highlight few things that I think are important to know what we are doing and where we think we could achieve the best working together. And then I would leave the time for questions, because that is where I can answer what really interests you and not consider myself what would be interesting for you. So in principle, e-health is, I would say it can be divided into two groups. One is that it allows to do things that we do anyway in a modern, faster, maybe better organized way. And that is an example of electronic health record, because the records are kept anyway. Now we can keep them in an electronic format. Or e-prescription. Prescriptions are prescribed, we just do it in an electronic format. The added value of doing it would be that the electronic prescription would be accessible in another member state, which is currently yet not the case. Also, there are already have done the project on that, and it demonstrated that it is possible, but there is a need for alignment between the member states, in particular as regards the questions on interoperability. And interoperability in all its four senses. It's the questions of technology, it's the question of semantics, it's the question of legal questions, and also the organizational things. That equally applies for electronic health records. And what we have seen in our studies of 2013, that majority of general practitioners and hospitals in Europe actually have electronic health records, but they don't tend to share this information that they have. But in principle, just having an electronic health record in your computer is almost as good as on the paper, because the benefit comes from the scaling it up. If we would have a database where we could easily search for information about the similar case with the similar phenotype, genotype, and we would find much faster the diagnosis and much faster the better treatment that would be suitable for this patient. But that can only be achieved if we would apply, of course, the requirements of data protection, but also that we will allow the creation of this access to information. Of course, it would start with the first steps by giving an access to electronic health records in another member state when a patient needs help there. That's the first step of it. Or I would say that, no, that's not the first step. The first step actually is when the hospital and general practitioner share information between them. Because we see that this question of interoperability very often doesn't appear across the borders, it actually appears across the street. So the questions of interoperability that would contribute to the better health outcomes. And I would also highlight in this context one point, access to information to patients. We had 2 studies recently finalized that looked into the impact of electronic health tools in principle, including electronic health records, if they will have if patients will have an access to them, and whether it would contribute to the patient empowerment. And all sites where these projects were conducted demonstrated that patients actually are very interested in having this access, while the doctors' community in some regions was quite against it, saying that patients don't understand and they need information to be explained and it is not perhaps a good idea to give them this access. Then patient response to that was, we don't care that we don't understand everything, but we want to have an information, and then we will find out. Then another thing that we are somewhat doing, but maybe not as extensively as it could be possible today, is about telemedicine. Telemedicine for teleconsultation and telemedicine for telemonitoring. That people do not necessarily have to be in a hospital to get all kinds of valuable information about their health status. They can also be at home. And they can also be on holidays in another member states where they can still collect this information, and then it could be linked to their electronic health record, and that would give much better overview of a patient condition. Because you know, as it is, you see a patient once a month, but patient sees a disease 30 days a month. So there is much more information with a patient than it can be deducted from one visit to the doctor. And what I would also highlight is question of deployment. One is awareness. Do we all know what these tools can offer and what we can achieve with this? Sometimes we also have to, for convincing argument, we have to have an evidence, and that demonstrates that telemonitoring, teleconsultation, all these work as effectively as traditional medical ways of treating or diagnosing. And the last bullet point in that line, the digital health literacy, is also very important. We found from our Eurobarometer in 2014 that 60% of citizens actually actively look for health information in internet. And they also, from that Eurobarometer, it showed that they seem to understand what they find in internet, which is a bit controversial with the Maastricht survey on the health literacy in Europe, which demonstrated that, on the contrary, less than half of the population actually have sufficient knowledge of health literacy, which means that in order to understand what you read, you really have to have a health literacy, but in order to find where it is, what you can trust, you need a digital literacy. So it's a combination of 3. Digital health literacy. Of course, it requires an access to internet as well. That is also one of these key points of the digital agenda for Europe, but it also needs the development of digital skills, in particular among the elderly population. And all these points, that's my last bullet point on these slides, all these points are also addressed through the Horizon 2020. It's a research and innovation program in which there is quite a lot of money allocated for the projects on ICT for health under the Social Challenges 1 chapter, and that includes a wide variety of different ideas. It's about the virtual physiological human to understand the physiology and the pathology and the treatment options. But it also involves the creation of mobile health applications, for example, for patients to actively monitor themselves or to find a contribution to their daily life or basically empower them. So that is a lot of opportunities, and I'm very happy to answer any questions that you may have on this subject. But anyway, thank you very much for your attention.